A 12-year-old male schoolboy presents with acute wheezing, cough, and shortness of breath worsening over 2 days after a cold, interfering with playground activities. His pediatric age and male sex increase prevalence of childhood asthma. He has a history of atopy and uses albuterol PRN. Physical exam shows respiratory rate 35 per minute, intercostal retractions, and diffuse wheezes. Laboratory values include peak expiratory flow 45% of predicted, and arterial blood gas with POW 285 mm of mercury. Pertinent diagnostics: wheezing in 90% of exacerbations, with peak flow less than 50% indicating severe attack.
What's your diagnosis?